The current state of homelessness in the United States is not a sudden blight, but the culmination of 4 decades of deliberate policy choices, starting at a ground zero moment around 1980. For most of the 20th century, mass homelessness as we now know it, entire communities sleeping on sidewalks and in parks, did not exist. The prevailing social contract, though imperfect, ensured that basic SRO, or single-room occupancy, housing was available for low-income workers and those struggling with mental health. However, as the 1980s dawned, a shift began, one rooted in budget cuts and a philosophical dismantling of the federal government's role in housing. This marked the start of failure that would see the nation's unhoused population swell, forcing millions of the most vulnerable citizens onto the streets where they remain today. More than a tent, the new face of homelessness. The face of homelessness in modern America is far more complex than the image of the chronically unhoused individual on a park bench. It is a crisis rapidly encompassing families, the working poor, and seniors. According to the 2024 point-in-time PIT count, the number of people experiencing homelessness rose by a staggering 18% from the previous year, documenting approximately 1.5 million people on a single night. Most distressingly, people in families with children saw the highest increase, surging by 39%, with nearly 300,000 children under the age of 18 experiencing homelessness. These are the newly homeless, people who are working, people who are managing disability benefits, but who have been crushed by rising rents. They are the 36% of the unhoused population found in unsheltered locations, a number that continues to grow despite the expansion of shelter capacity. The data starkly reveals that the problem is no longer confined to chronic individuals. It is an economic failure that is now devouring the stability of middle and working class families. The rise is so profound that even seniors, the over 65 population, accounted for over 91,000 people experiencing homelessness, showing that decades of policy failure have eroded the safety nets for every demographic. This crisis is a deep structural wound, forcing thousands of formerly stable Americans into a desperate and visible struggle for survival. The loss of affordable America. The most fundamental reason America cannot solve homelessness is the catastrophic, 4-decade erosion of the country's supply of affordable housing. This didn't happen by accident. It was a consequence of a nationwide demolition of the low-rent housing stock that once served as a default safety net. Today, the United States faces an estimated shortage of 7.3 million affordable and available rental homes for the nation's lowest-income renters, a staggering figure that highlights the chasm between need and supply. This critical gap ensures that for every 100 extremely low-income renter households, there are only 35 affordable and available rental homes. This shortage is largely due to the loss of single-room occupancy, SRO, housing, which provided millions of inexpensive rooms in urban cores. Beginning in the 1980s, the economic incentive to convert or demolish these units for market-rate development became irresistible, a practice often spurred by local zoning changes and redevelopment grants. When a room costing the equivalent of a few $100s a month vanished, the tenant had nowhere to go but the street, creating the immediate visibility of the crisis. Furthermore, speculative housing bubbles and the financialization of rental properties have priced even modest apartments out of reach, ensuring that the foundational barrier to ending homelessness remains. There simply isn't a safe, decent, and affordable door for everyone to walk THR. Oof. The Great Betrayal. How Congress gutted U.S. housing. The transition from society with housing issues to one with mass, visible homelessness was cemented by a profound federal betrayal. The systematic gutting of the U.S. Department of Housing and Urban Development, HUD, budget in the early 1980s. Before this period, federal programs actively built public housing and provided subsidies to expand the nation's affordable housing stock. This commitment effectively ended when the budget authority for HUD was drastically reduced. The department's budget authorizations, which were approximately $32.2 billion in 1981, were slashed to a mere $6.9 billion by 1989, representing a precipitous cut of nearly 78% in commitment power over that decade. This wasn't merely a cost-saving measure. It was a philosophical declaration that the federal government was abandoning its decades-long commitment to housing as a public good. Crucially, the budget cuts specifically targeted the programs that created new housing units. For example, while Congress authorized nearly 55,000 new units of public housing in 1979, just 5 years later, the number of units authorized was effectively zero. This decision shifted the focus from production to maintenance, starving the nation of the housing stock needed to keep pace with population growth and economic pressure. Even as outlays for existing programs increased, they only served a mass catastrophe. The federal government permanently ceased being a force for expanding affordable housing, thus ensuring that the housing gap created in that decade would widen into the crisis seen today. This political failure, more than any other single factor, laid the foundation for the 4-decade persistence of the problem. The rent trap, when a full-time job isn't enough. For many Americans, homelessness is a simple calculation of income versus housing costs, demonstrating that the crisis is fundamentally an economic one. The problem is simple. Stagnant wages have been utterly destroyed by soaring rents, trapping millions in a relentless cycle of financial precarity. The National Low-Income Housing Coalition reports that a full-time worker needs to earn an hourly wage of approximately $33.63 to afford the average modest 2-bedroom rental home in the U.S. and afford a modest 1-bedroom rental home for $28.17 per hour. Compared to the federal minimum wage of $7.25 per hour, this reveals an astronomical gap. In many high-cost areas, the situation is far worse. A minimum wage worker would have to work an average of 106 hours per week, the equivalent of nearly 3 full-time jobs, just to afford a median-price apartment, while spending only 30% of their income on rent. This rent trap ensures that any unexpected expense, a broken car, a medical bill, a reduction in hours, is all it takes to trigger a descent into eviction and subsequent homelessness for millions of low-wage renters. The end of pandemic-era protections and benefits, such as the expanded child tax credit, only accelerated this process, pushing people who were previously just treading water into the deep end. The statistics are a sobering indictment of the modern labor market. When 2 parents working full-time at minimum wage still cannot reliably afford a 2-bedroom apartment for their children, the American economic system has essentially mandated housing instability for its lowest earners, ensuring a constant flow of newly unhoused individuals and families. Legacy of redlining, race, housing, and the wealth gap. The homelessness crisis is defined by a profound and painful racial disparity, a direct legacy of systemic discrimination rooted in housing policy. People of color are dramatically overrepresented in the unhoused population, a disparity that reflects decades of wealth extraction and housing segregation. Black Americans, for example, represent only about 12% of the total U.S. population, yet they account for nearly 32% of all people experiencing homelessness. Similarly, Hispanic/Latino individuals constitute approximately 30% of all people experiencing homelessness, highlighting a severe overrepresentation. This disparity is inextricably linked to policies like redlining, a practice officially codified by the federal government and private institutions that denied mortgages and investment to black and minority neighborhoods from the 1930s to the 1960s. This created segregated, disinvested communities and prevented generations of black and brown families from building home equity, the primary source of intergenerational wealth in the United States. When the housing crisis hit, these communities, lacking the financial cushion of homeownership, were the most vulnerable to eviction, predatory lending, and displacement. Therefore, the crisis is not only an affordability problem, but a structural one, where compounded economic disadvantage inherited from legally sanctioned racism ensures that when housing fails, it disproportionately claims the lives and futures of people of color, making the solution impossible without addressing the systemic roots of this racial wealth gap. The shelter system trap. Treating symptoms, not disease. Following the abandonment of housing production in the 1980s, the federal response to mass homelessness pivoted to a shelter-first approach, codified by the Stuart B. McKinney Homeless Assistance Act of 1987. While intended as an emergency measure, this approach became the default solution, transforming the crisis response into a perpetual system that treats the symptom of homelessness while ignoring the disease of unaffordability. Today, approximately 64% of the unhoused population stays in sheltered locations, but these are often temporary, restrictive, and congregate settings that create a shelter system trap. The focus remains on managing the flow of people in and out of shelters rather than providing the permanent, affordable exits needed. This approach is not only inefficient but creates immense friction. Many shelters enforce strict rules regarding sobriety, family units, or curfews, inadvertently excluding people with unaddressed mental health or substance use issues, or couples who refuse to separate. This failure to offer housing without preconditions pushes many back onto the streets, making the overall system expensive and ineffective, rather than funneling scarce resources into costly emergency beds that offer no path to stability. The reliance on the shelter system only ensures a constant and cyclical crisis, reinforcing the devastating reality that managing poverty is often prioritized over ending it. The criminalization cycle, poverty as a crime. Instead of investing in permanent solutions, many cities have chosen to manage the visible presence of homelessness through enforcement, creating a costly and counterproductive criminalization cycle. This strategy involves the systematic use of ordinances, such as anti-camping, anti-loitering, and anti-panhandling laws, that effectively criminalize basic human needs like sleeping, sitting, or resting in public spaces. The data proves this is an economic failure. Studies consistently show that the cost of criminalizing a single chronically homeless individual through arrests, court time, and jail stays can cost taxpayers an average of over $31,000 per person per year. This figure is nearly 3 times the average annual cost of providing that same individual with permanent supportive housing, which costs an estimated $10,000 to $15,000 per year. The irony is devastating. The money spent on punishing people could be used to house them. Furthermore, the criminalization process does lasting harm by creating permanent police records, which become an insurmountable barrier to finding employment or securing future housing assistance, locking people into the cycle of poverty and incarceration. Research shows that jailing and ticketing do not reduce homelessness. On the contrary, enforcement-led encampment sweeps lead to the dispersal of communities and the severing of vital connections to social workers, making it harder to link individuals to housing programs. This punitive approach is not only a moral failure, but a massive financial waste, guaranteeing the continuation of the crisis by actively blocking pathways out of homeless. Ness, the right formula, cities that broke the code. The decades-long failure to solve homelessness is not a testament to the problem's intractability, but to the persistence of failed policies. The glimmer of inspiration lies in the cities and communities that have recognized the underlying failure and chosen the effective, evidence-based solution, housing first. The core principle of this model is simple: provide permanent, unconditional housing immediately without demanding preconditions like sobriety or employment, and then offer voluntary supportive services. The data unequivocally supports this approach. Systematic reviews of housing first programs show they achieve housing retention rates of between 75% and 91% after 1 year, significantly higher than programs that require sobriety first. The financial benefits are equally compelling. A wide range of studies have shown that providing permanent supportive housing can lead to public cost savings ranging from $1.44 saved for every $1 invested to over $20,000 in annual savings per person due to reduce use of emergency services, hospitals, and jails. Cities that are committed to this model on a systemic level have seen dramatic results. For example, communities that have prioritized the housing-first approach for veterans have effectively ended veteran homelessness, achieving a reduction of over 55% in the veteran homeless population since 2009, proving that targeted, housing-focused efforts work. The city of Salt Lake City, Utah, famously used this model to drastically reduce chronic homelessness, demonstrating that the political will to treat housing as a fundamental necessity, rather than a reward for sobriety or employment, is the genuine key to success. The solution is not complex. It requires diverting the money currently wasted on the shelter system and criminalization, the over $30,000 per person spent on punishment, and investing it into the $10,000 per person solution that provides a permanent home. The problem is not a mystery. It is a choice. America has spent 40 years failing to house its citizens, but the blueprints for ending the crisis exist and are proven effective, waiting only for the political courage to implement them.